Hey mamas! Welcome back to another episode. I'm Jess.
I'm Erica.
And today, guys, we have Tanya. And today she'll be sharing her journey with I can't say. And today she'll be sharing her journey and what it's been like living with I can't say it, Erica.
Okay, I'll say it. And today she'll be sharing her story, what it's like to have endometriosis.
How are you?
I'm good, thank you. How are you?
Good, lovely to meet you.
How was your day today?
Yeah, not too bad. A really long, like work as always, and then just flies by the days. How were your days?
Good. First day back at school. Well, not for me, for the kids. So it was amazing. Not gonna lie, I missed them a little bit. But then I kind of thought, what is wrong with you, Erica? Like, you've prayed for this.
What did you do with so much silence?
I didn't know what to do. I feel like I did more now with them gone than them here. When Joel got back from school, I was sitting on the sofa and he just kept talking and I was like, no, I don't really enjoy this. Like, why are you talking so much? Why did you come back with so much energy?
You hadn't even dropped him at school and you were already saying you missed him, so I don't know what you're talking about.
It's just a lot. I don't know. Like right now, I feel like I've done so. And the thing is, I took the day off of work because I thought, yes, I'm going to take a nap. I'm going to, just chill. I didn't do any of those things.
Always the way.
Mama's Code.
And we're very excited because personally, I can't even say the word, so I'm not even going to try. Take it away. Let us know, how did this all start?
I don't know. I should just say, oh, hi, I'm Tanya. I'm 29. I'm from London. My day job, I manage a domestic abuse housing service. So very full on, very, very tough during the pandemic. And then kind of on top of that, managing a chronic illness. So I suffer with endometriosis. And I first started having symptoms when I was at university. So I was around 18, 19. And that's the earliest for me that I can remember having heavy periods and fainting and vomiting just from having a period. It just feels like your body's on fire and something just needs to escape, and pain was just unbearable. And I can remember just going to the doctors on campus and saying, oh, I've got a really bad period, what do I do? And they just sent me away with painkillers each time. And I came home and they sent me away with painkillers, and they really normalize it for you. And I don't know if it's an age thing, and I was told it was because of my ethnicity as well, where you've got, the stronger pain thresholds. And yeah, I kind of just got sent away for years and years and years with just stronger painkillers each time. And then progressively it gets worse and your body starts changing and more things happen. So for me, I just started developing all these bowel symptoms as well.
Sorry, at the time when you were getting the stronger painkillers, was it even helping you?
It did for a while. It's like one of those things where you have to take it every few hours, or you're taking like 2 or 3 at one go just to be able to get through the next few hours. When I started working, so just before I started having bowel problems, when I started working, I had to wake up, take the painkillers, go back to sleep, wait for it to take effect, and then call into work. And I would be calling in sick to work every month for at least 2 days, or calling in sick for half the day. And I was just fortunate that I had decent managers who I literally just said, sorry, I've got a period, I'm coming in late, whether you like it or not. I just had to deal with it, really. I don't know where my confidence came from to even say I was having a period, let alone I've never had sick days either. So to have a sick day for my period was just quite huge, I think, for me at the time. I even went to A&E a couple of times and the doctors kind of gave me the wrong painkillers, and that barely even touched the sides. Whilst I was working is when I started having the bowel symptoms, and it just felt like I was going to the toilet every time, and I couldn't retain my food. I was losing weight. If I'm not losing weight, I was feeling nauseous. I just felt like I was eating the same thing every day to try and control it. And then I went to the doctors again and they just said, oh, you've got IBS, no tests, no hospitals, no referrals, nothing. You've got IBS. Again, sent away with medication to deal with the problem and told to cut out dairy and gluten. And that was the end of that. It was like nobody knew what endometriosis was. Nobody knew, or nobody told me that it could spread. And yeah, that was kind of the beginning to middle of trying to get a diagnosis.
What exactly is it? Is it not I think, is it a lining in your womb, or am I completely off?
Yeah, so it is tissue that is similar to the lining of the womb, and then that tissue kind of starts growing and spreading in other places. I don't think they actually know what causes endometriosis, and there's no cure for it either.
Could it be prevented?
I don't, that's a good question, and I don't actually know the answer because for me, no one in my family has it. So, and none of my friends knew about it before I had it either. So, I don't actually know if it's something that just happens. Um, if they don't know what causes it, I guess they don't know how they would prevent it.
How long have you been living with this?
So I think from when I was 18, 19, I was diagnosed properly at 27. I had 4 surgeries in a year that I was diagnosed, and then it came back 10 months later. So it started growing again. And I don't have periods at the moment either. So I don't even think they can attribute endometriosis to having a period because clearly not.
Could you get pregnant with this condition?
So yes and no. So I've come across a lot of people that have fertility problems because of it, because it affects all your fertility organs. But at the same time, I've seen people that do have children. So I think it's so individual and independent to the person. But for me, they've told me that they don't know whether I can fall pregnant or not. They don't know what my fertility is like. It's a thing of, oh, if you try and it works, great. If it doesn't, then you just have to get fast tracked to a fertility clinic. Um, like even look at the cost of freezing my eggs, it's just something that's so expensive, and to have to plan for that as well, it stresses me out a little bit having to think that far ahead into the future when you don't even know what's going to happen like in a couple of months' time.
Is it fair to say that this is just the whole chronic illness is just in a grey area where there's just not much out there?
There's a lot of awareness, I think, that needs to be done around what is normal for that person and for a period. Like we all know our own bodies, and for me, if I'm going to the doctor and saying that I'm fainting and vomiting on my period, that's not normal for me. I was never used to that, and then I became used to it. Like ended up, fainting in, like, vomiting in my car on the way to work and stuck in traffic, and fainting on public transport whilst strangers were thinking I was drunk in the middle of the day, and nobody would help me. Like I came out, I remember just coming out of the train and I was so close to the tracks. A TFL man had to grab me before I fell over onto the tracks.
Oh my God.
And I could just see white lights, and I was just stumbling trying to find the exit and scared that someone might steal my stuff. And yeah, just there's nobody there to help you. And I think there's a whole like gaslighting problem. The diagnosis time takes far too long, and I think for me as well, there's the whole problem around ethnic minorities and what they see as pain and stigmas and taboos, because I never really spoke about my periods until I started having pain. And I do have a loving family and loving friends, but to have that conversation was quite difficult.
Would you say that that's mainly because of your upbringing? Obviously, like we have similar situations where our parents didn't speak to us about periods, so talking about it was a bit hard than just freely being okay to touch on the subject.
Yeah, I agree. And I think if you don't have an adult, or I guess even a friend to speak to about what your body is going through and what your changes are, then I think you naturally maybe just keep it to yourself without having that conversation. And even in school, having a period was such a taboo. I remember like girls starting when I was in year 6, and they were pinning it on each other, or we were all pinning it on each other because we didn't want to be the first person to start our periods, and the only person to say, sorry, I can't do swimming or I can't do PE because I'm in pain. And then that carried on through into secondary school, and I went to an all-girls school, and the kind of bullying was rife, and people picking you out was just second to none, and you don't know what to do with that. So I think then you naturally become introverted if there's no one to speak to. Or like back in the day, PHSE lessons, it's like, I don't want to know about a period, I want to know about, I don't know, something else. And it just gets, I don't really remember learning much about it either, or learning about the body, or like the menstrual cycle, or just the changes that you go through naturally as a woman and a female.
How crazy is it? I went to an all-girls school as well, that knowing that you're in a building where everyone is going through the same thing in year 7, for instance, and no one talks about it. Like, I remember when I started mine, I went out and I told my best friend, and I was like, oh my God, this just happened. Like, I'm a woman now. And then she looked at me like, oh, like, you're a bit late, babe. And then as everyone started getting it, everyone would like hide their pads in their bags, and they all had this little special pouch for it, and God forbid anyone saw the wrapping paper for it. And or like if you went to the toilet, they'll tell, for instance, I'd go with my friend and she'll say, oh my God, put the tap on so no one else hears me undo the pad. And like, obviously at the time you kind of think that that's just how it is because that's the way you're raised. But if you look at it now, like, if we both have boys, but if we were to ever have girls, I just think that's where you start. Like, look, everyone bleeds. Well, most women bleed, because we've had a guest that she never got her period and she was like 17, and it later surfaced that it was what's it called, MRKH.
Yeah.
And as you were saying, that no one really talks about it in education, and I mean, they will say in biology, you know, girls menstruate and that's about it. It happens once a month, and no one says, you know, they're super heavy or they last long, or some people, they're not even periods, or you don't even get periods. So you're sitting there thinking, okay, what's this then?
Yeah, and I think it was in primary school when we had like sex ed classes as well, and the girls and boys would be separated, so you don't even get, or the teachers don't even get a chance, whether they want to or not, to try and educate the boys alongside the girls. And I don't know if they're too young, or I don't know if it happens in mixed schools. It just seems like it's a you problem, it's a female problem, it's just put to one side. Like, I remember other girls starting periods in their school when, it might be too graphic, but some girls would just bleed when they first started, and it's just like she's bleeding and I've got mine, you've got yours. Why are we then making comment about somebody else? But you're right, it's like when you reflect on it, you think it's such strange behavior.
I went to a mixed school, but I felt like it was like judged, like, you're on your period. Like, everyone associated that to like nasty blood coming out of you, when in reality, like, yes, you know, it's blood that has to come out, but I wouldn't see it as nasty, you know, because it has its process. Like, now when you educate yourself, you know, you have to get your period in order to, you know, fall pregnant, and all of this kind of like ties with each other. But before, it was kind of like, yeah, no, I know for one, some girls in my school would prefer not changing their pad throughout the whole day, then God forbid someone seeing them go to the toilet to change their pad. Like, I had a friend that she would leak. So, you know, when your period's very heavy, because she was so embarrassed to go and change her pad, she would prefer just leaking and like having like a pool of blood. And then she would just be like, oh, that's not mine. And then we can still see through black that you clearly are on your period and it's you. You just got up from that chair. It's very hard to lie and move from that. But it's like, why can't we normalize that, you know, us as women, we get periods? And it's funny because it's usually the women's like that are picking on you. So, like, yeah, I did think you smell a bit fishy, or sly comments that would just get you like, well, so you smell of roses when you have your period? Like, what is the issue?
No, and I think that like it carries you through into like your teenage years or your early 20s, when you've got a partner and you're thinking, oh, I can't go and see them, I'm on my period, and I can't even come to your house on my period, and we can't even go out because I'm on my period. Well, no, it's so normal. If you're with the right person as well, they should understand. I'm sure you've got a mum, a sister, an auntie, a cousin, there's some sort of female person in your life. Whether you've had that conversation or not, you must have that awareness, even if you've not spoken to somebody about it.
Mama's Code.
When you got diagnosed with it, was it after some sort of different evaluation on your body, or?
Yeah, so I was referred to a community gynecologist who, his first kind of response to me was, oh, you can go and get pregnant. I was like, sorry, what? Like, who's going to get me pregnant? And when I said that to him, he just stared back at me, and I was like, well, exactly my point. And he gave me 3 ultrasounds, and I think a cyst or 2 showed up, and then like nothing else really showed. Because nothing showed up, it's just like, okay, maybe I'm complaining about nothing, and maybe he's right. But then eventually, I think it was a year and a half after that, they referred me to a hospital. The hospital lost my referral. It took about 6 to 8 months to get to the hospital. I think by that point it was, I think, January 2019. And then I had what is called a transvaginal scan. So it's one of those invasive scans that they put inside of you, and they saw then the extent of the endometriosis, and they said that it had spread all over my bowels, my ovaries, my uterus, like up towards my kidneys, on the tubes between your kidney and your bladder, and that it would require a minimum of 2 surgeries to deal with it, and that all the organs were stuck together and had been pulled backwards.
Do you know what? You're not the first person that we hear, and even from our people around us, that they go continuously to the doctor with the same, problem, and they keep sending them off with paracetamol, whatever it is, to the point that their life is genuinely at risk, and that's when they find the issue. And I don't know if it's like, I don't want to diss the NHS and everyone that works, because I know that they do work hard and it's all under one system. But if this happens continuously, would you not think that maybe on a second visit or a third visit even, take it to a level where, okay, no, we should send you off for different type of evaluation, scans, test, rather than continue with, well, clearly painkillers aren't working? Or
I think personally, some doctors just lack empathy. And I think it's that, because I feel like some people are like, yeah, well, like you said, Tanya, why were you made to feel like, or maybe I'm just complaining and it's nothing? Why? How can someone tell you what you're feeling if only you could feel that? Surely, like you've said, I know my body. I know there's something wrong. I remember I went to the GP on a Friday because I had a really bad headache and I suffer from migraines. And he was just like, yeah, no, it's fine. The next day, I could not see light. And I remember on the Friday, I went to pick up my eldest from the nursery. And I could see like lights and I couldn't look up. And I was just like this. And I don't know how I picked him up. The next day, my mum had to come and get me out of my bed, take me to the hospital, because she was like, we could not live like this. Why? Because someone in our family died from a headache. Took me to the hospital, and what was it? Meningitis. So it's like, had I not had my mum who forced me to go, I probably, you can die from meningitis. And I've seen multiple people go. Like we had a lady come in to say that her mum showed so many symptoms and kept repeatedly going to the doctors, just like you, she was dismissed. They will say, no, it's this or it was that. And then when she came and magically saw a doctor that actually cared, he was like, oh yeah, you have stage 4 cancer. Like, how do you miss such a vital part? Like, you studied for this. And this is what irritates me, because I get some doctors are dedicated and I've had doctors in my GP, for the most minimal things. Oh yes, we're going to thoroughly do this, we're going to do that. But I've also had doctors dismiss things like, yeah, no, it's probably this. And they won't even, like, they'll go on Google and type. And I could have done that at home. I usually go on Google before going to my appointments and I tell the doctor what I'm diagnosed with. And they usually like, what? No, it's not that. But I'm like, I have to do your job for you. I feel like I almost have to go with a case. And the same thing happened to my dad. My dad kept moaning from a headache. All of a sudden, my dad, like, he would randomly have like this rush of like sweat and he would feel cold. He lost all his hair. As a man, you've got hair in your arms, your legs. He lost everything. It took a year of constant me emailing, blah, 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 calling his GP and him changing GP for the new GP to tell him he had a tumor on his head. It's these things that make you, like, just like we reacted to you. Like, how is it that it took so long, and why is it that you were made to feel like, oh yeah, no, it's probably just me complaining for the wrong things? No, we shouldn't be dismissed for the pain we feel we have.
You know what? And I wonder, like, GPs, they're not the specialists, and I don't know why they kind of gatekeep just sending a referral over. Like, I've had it my whole life in terms of other medical problems as well. Like, when I was at university, I had I don't know if it was like suspected meningitis. I just broke out in a rash all over, and bearing in mind it was so physical and so visible, and they just sent me away. It's like there's this thing all over my body, and I think it was after like 3 weeks or so, and then I ended up in hospital for about a week. And I could remember hearing the doctor saying, oh, well, she's not stabilized and she's going to die. Well, how did I get to the point of death when I went to you like 3 weeks ago with physical signs on my body? I don't know whether it's like they don't want to do paperwork, or they don't know everything. We know they don't know everything, but then send me to someone that does know.
How did you feel when they gave you your diagnosis?
I cried. Like, I don't know what I was expecting. I hadn't heard much about it before. I think it was just so overwhelming when someone, I guess, they tell you what you want to hear but don't want to hear. Yeah, I broke down. I was with a nurse, and my mum was sitting outside, so I didn't want my mum to see me crying either. So I cried with the nurse. She was giving me all this information, and I think it was just information overload as well. And because they said they wouldn't be able to deal with the problem in one go, I'd be in and out of hospital with more tests and a minimum of 2 surgeries. It just, yeah, it was really overwhelming and quite emotional after so long. And it's just like, finally, someone can give me an answer, but I've still got a long way to go.
Did you start treatment immediately, or was it surgery first?
So I had a diagnostic laparoscopy, which is like keyhole surgery. Again, they didn't tell me what I was expecting at the time. So I thought, okay, I'll go in for the surgery and I'll be fine afterwards, and they will remove everything and then I can get on with my life. They went in, it was a day surgery. Then they came to me and said, oh, it was too complex to deal with. You have to come back later on in the year. I'm like, great. Then I went on induced menopause for a couple of months, and which shut down my ovaries. And also it gives the same effects as a normal menopause. And then had a 10-hour surgery in October 2019. They told me it would be a couple of hours, I'd be off work for a couple of weeks, and then I'll be fine afterwards. I was in the hospital, I think, for about a week. I was off work for 6 months, and I had 2 other surgeries following that, and a third that was unrelated to endometriosis. That all just happened to come in one go.
So you basically moved into the hospital.
I just lived there for a year and a half.
Oh my God. Do you know what? Just before, when I was setting up, I saw this fact that it said that on average it takes 7.5 years to get a diagnosis for this.
Yeah.
That's insane.
Even a bit longer. Yeah. Because I think everyone normalizes period. They normalize a painful period. So if I was to go back to a GP again and say, oh, I've got really heavy periods, they'll probably just send me away with painkillers rather than investigating the problem. And then going to complain about the same issue, wouldn't you just look at my medical history and see I'm coming back to you like every month for the same problem? Like, why can't you help me?
It almost makes me think that how many women are out there living with this and have no idea. Like, Erica, I think I mentioned it to you a couple of weeks ago. My sister suffers from really severe, she's an open tap, and she's always dizzy. It's not her iron. They never know. They literally just say, oh, it's just your heavy period. She went to a GP 2 weeks ago, and they were like, yeah, you should probably start having sex and that might sort you out. My mom was fuming because he was like, firstly, that's just not professional. Like, at her age, so yeah, okay, some people may be having sex at that age or not, but if she's telling you that she's not there yet, how are you sending her to go have, do you know what I mean? It's like, Well, if she's coming back month in, month out, she's spending time at home because she can't do anything because of her period, do something about it. And she's been complaining about this since, God, I don't even know, probably 5 years. Have
It's
sex.
outrageous. And what really, like, it really grates on me is that these doctors, there's no one else in the room with them. And I'm sure, obviously, when they write their notes, they're not saying, I advise this person to go and have sex. And you're like, you've got no leg to stand on after you leave that room.
Yeah, because you can't even record the conversation. You don't even know if they're going to say something stupid. But I honestly, like, with GPs, like, it's, I don't know, like, I'm always like very skeptical. I've had good ones and I've had really bad ones, but you just never know who you're going to get. That's why sometimes when I feel like people who do go through a lot, like in terms of pain wise, and sometimes they just resort to, you know what, I'm going to deal with it by myself because the GP is going to turn me away anyways. So I might as well just do things on my own. It's time consuming going to a GP. You know, you have to go to a time slot that it's good for them, not good for you, because, you know, usually they don't do appointments for people who work, you know, 6:30, 7:30. So it's quite, you know, you have to take time off of work, and then you go there and they dismiss you and say, yeah, no, take paracetamol. It's like, what? Like, I feel like I'm dying and you're telling me to take paracetamol.
You know, my partner, he went to the GP about this pain that he's got, like, here, and he can't breathe. And the doctor, on his referral letter, the GP said, this 30-year-old man keeps complaining about something going on in his nose. Please give it. It's this 30-year-old man keeps complaining. Honestly, we looked at it and I said to him, "No, this must be a joke. Like, come on."
I mean, I could write that. I could diagnose him.
Did you feel any improvement after your first surgery?
The first one, no, because it was just diagnostic, and then I had to have the menopause. I went through. I had a colonoscopy and endoscopy as well, because again they tested for everything but the bowel endometriosis. So I had all those tests. I think I was even tested for like celiac. I had various blood tests in that time. And then it was keyhole surgery again for the bigger surgery. And I remember the doctor, the consultant, coming to tell me afterwards, he said it was one of the most complex keyhole surgeries he's done, where he's had to do a bowel resection as well, because from that I've got my stoma bag now. So I've got this bag on my stomach and my intestine popping out.
Wait, let me think about what I'm going to say, because I can't say the words.
Is that forever? That's my question.
Yeah.
So do you have to have it like that all the time?
And every person that is diagnosed with endometriosis, do they all have this?
No, so everyone with endometriosis, there's like different stages, but the stage doesn't correlate to the amount of pain you feel. And from what I understand, the doctors don't prefer to give people stoma bags unless it is like such a dire situation and they can't avoid it, because I think they either prefer to do the bowel resection or shave the endometriosis from the bowels. Mine isn't permanent. It was supposed to be temporary for 2 months and it's almost been a year and a half. But my bowels haven't, I think they're the healthiest they've been. And I'm a bit scared to know what it's like to go back to having.
Oh my God, yeah. Like, would it hurt?
I don't know. Like, it gives me a bit of anxiety to think about how my body will respond. And because it took so long to recover from the last surgery, I don't have the headspace to go through that again and that whole recovery journey.
Is
Because
that
apparently the bowel's your laziest gut. So to get that working again, I can't imagine how long it takes.
Oh my God, like, I'm literally squeezing my anus right now. Like, clenching. So wait, you're saying that they realign it, so they put the ends of, like, how does that work? Like, how do they, like, stitch you up at the end of your intestine and just open, like, you know, a hole here so that it comes through? Like, I just explain, please, if you feel comfortable with it.
I'm trying to think of the best way to explain, because I don't think I've like dug that deep into it, to be honest. So I've got what is called a loop ileostomy. So my intestine that comes out on my stomach. There's like two parts of it. When I had the surgery, they said they cut quite low to my rectum, but they didn't say how low, and they didn't say how much they took out either, even though I asked everybody and they couldn't see it on my notes for whatever reason. So I don't know how much they've taken out, but I think when they reattach it, they wait for the ends of it to heal, and then they staple it back together or realign it back together, and then they leave the wound on your belly to kind of heal over itself.
And you don't feel when it's coming in, like, into your bag?
No, so it doesn't have any nerve endings. The only time
so
I
cool.
feel it is the only time I feel it is when I've eaten something like maybe nuts or something that's difficult to digest and it's struggling. But otherwise, it's like I'm sitting here talking to you and I'm going at the same time, or I'm like in a meeting and I'm going at the same time.
This feels amazing. Like, I know it's not the ideal thing to say because obviously you've had your struggles, but I find it fascinating. Imagine like being in a meeting, like you really need to poo, and then you're just like, I was just looking at a meme. And then it reminded me, like the other day I was talking to my friend and I'm like, if you had a superpower, what would it be? She was like, I would point at like, if I need to pee, I would just point at someone and pass my pee to them so I never have to go to the toilet. And I was like, oh my God, it's actually an amazing superpower.
Honestly, talk about multitasking.
So true. And like the first thing my sister said to me was like, oh, you don't have to go to the toilet anymore. I was like, well, I still have to pee. But I know what you mean. I think the science of it, the science behind it still amazes me, to think that like modern medicine, I know it took as long as it took, but modern medicine allows me to have a life where I don't need to struggle to go to the toilet, but now it's coming out of my stomach. It's just, it's bizarre.
Honestly, and the human body, the way everything is just perfectly in line, and for it to work around you as well. Sorry, question, because I know one of our friends will probably want to know this. If you eat a lot of spicy food, will it hurt you?
No, like I can eat spicy food, but that doesn't affect me. It's like the different types of foods you will eat will affect the color and the type of output you have. I don't know how much you want, but like some people don't even like talking about poo and all the rest of it.
This is so interesting. Well, like, tell us everything.
Like when I had a cassava, like quite soon after my surgery, nobody kind of told me about everything. Like my poo just turned out white, and I was like, oh, interesting. Like I've seen the whole rainbow come out of this. And I think you just learn your body as you go along. Like if I eat lentils, the lentil will come out, like the skin will come out. I can't eat foods now that have roughage or skin. So like apples I peel, potatoes I'll peel, carrots you have to like soften them to a point where you can chew them so properly and then mush and then digest. Otherwise everything will come out, for me anyway.
Do you have to change the bag?
Yeah, so I change it daily, sometimes every other day, depending on if I've leaked or not. Yeah, and then empty it like 3, 4, 5 times a day, depending on how quickly it fills up, because you fart through there as well. So if it fills up with gas,
stop right
I am
there.
mind blown.
So when you fart, does the bag kind of go? Oof?
It balloons.
This is amazing.
Oh my God, this is
like even in meetings or when you're out and about. Like the other day, I was just sitting with my sister and she was like, "What's that noise?" I was like, "Sorry, I'm farting." Like I can't control it. It would just come out.
How's it been like working and obviously knowing like people maybe having to explain to maybe new people that haven't been around you and that maybe notice it?
So you can't notice it through the clothes. I mean, like if I was wearing like a tight dress and I haven't like bought granny pants or whatever to pull it up, then it will show through like that kind of clothing or a play suit. But if I'm wearing jeans or anything, like just covering myself, you can't see it. You wouldn't notice that it's full either. But in terms of work, like thankfully everybody's been so understanding, and I think equally as amazed by it to understand what it is and the function of it. Nobody's really said a bad word to me. I mean, even like on social media, I put a lot out there, but no, I've never had a bad comment or never been trolled or anything. So I've been quite, I guess, thankful that nobody's really given me any headache about it. not that they'd have a choice anyway, because it's not them that's going through it, but I've never had to like have
Yeah.
any beef with anybody or respond to any negative comments.
How did this affect your self-esteem?
When I first had it, it was like, I don't know how to handle this and I don't know what to do with it and I want it gone as soon as possible. Because in the hospital, you're like sitting on a chair and the nurse will come and show you how to change it. And you've just got this like flurry of your waist just on your belly. And I hadn't changed my bag in a couple of days because I didn't even know I had to. And your output after surgery is so different to your output when you start eating normally as well. So it just kind of, it took me aback. And then I think when I came home, every time I looked at it, I was fainting. So I had to have chocolate before I changed my bag just so I could keep my blood pressure up as well. And then you get used to it slowly but surely. And then I think even just through social media, my confidence grew a little bit more. And one of the main reasons I put myself out there was because I hadn't come across anybody who had endometriosis and a stoma bag and was like my background or my ethnicity either. So I think that gave me a little bit more confidence in my self-esteem. And then just speaking to people as well, like my friends, none of us knew about a stoma bag. My colleagues, nobody knew, but everybody's been willing to learn and kind of go on that journey with me, which has been really inspiring for me as well.
How hard was it mentally and obviously emotionally when you were going through it all? So like take us back to, obviously, I'm guessing like you already touched on, you know, being in so much pain and kind of not having the answers that you want to hear, then obviously getting the answers, feeling kind of relieved but also upset with the outcome. But just the journey there on from, because obviously it's a long process, isn't it? And could you get in this again?
Yeah, so mine's grown back. So I had my big surgery in October 2019. I had an MRI in, I think, June or July last year. And they said, oh, we can see it in the MRI that it's like, it's there again, because I was having a lot of pain and I still do get pain now, not as much as before, but it's like slowly getting worse and worse or just increasing. I don't think I had the headspace to go through more surgery again and again just to get rid of the problem. But it does take a toll on your like mental health. And I think I've only ever had one doctor ask me, how is your mental well-being? Like, you've been through this whole journey and nobody really asks you what toll it takes on you mentally. It's just emotionally draining, if anything, like to find the strength, I guess, to keep going back and to keep going back for the same problem. It's like knock down 6, get up 7.
Did you become obsessive with looking for information about this and looking for people that you could relate to? Because like say us, we're forever on Google, and like Erica said, she just breaks her nail and she's like, oh my god, I've got 20 hours to live.
I think when I was looking for information, like you Google, I'm having a heavy period, and so many things come up and you don't know where to pinpoint all your symptoms. And I didn't really have like my social media back then or anybody that knew anything about having a heavy period. And then when I was at work, I remember there was a colleague who was Googling all my symptoms for me. I don't know why. And then called me one evening and said, oh, Tanya, I think you might have cancer. And I was like, sorry, what? I was like, I don't need you to scare me like this. And he said, oh, I've Googled all your symptoms and this is what you could have.
Sorry to say it, but that probably would have been me too. I always diagnose everyone.
100%.
And people are like, shut up.
Yeah, I was just like, I don't know what to say. I don't know how to respond to you. Like, do I say thank you? Or yeah, scared me a lot more. But then I don't think with the whole collection of symptoms, I would never have thought something like this would have happened.
Do you ever blame your body? Like on a bad day, do you ever think, why me, or why has my body let me down? Or, you know, sometimes you start overthinking these things.
Definitely had those days. I think in hospital was probably the darkest days you have when you've come through and now you've already been through a surgery and you've got a recovery process to get back to how you were or get to a point where you feel that you can manage. But even just when I think about fertility, I always think, I mean, I'm not nowhere near there yet, but I've got a like niggling thing in my head to say, like, why can't my body be the one that carries a baby, or why can't my body get pregnant? And I'm not even trying or there yet, but I've already got that thought in my head. But because of endometriosis, who knows what my body is capable of doing? Yeah, it's scary, and it's like a lot of self-doubt of what your own capabilities are, and you don't know how far you can push yourself either. Like, even just sometimes doing a simple workout, I have to stop halfway through because I'm in too much pain to even continue.
Mama, I love you. We wanted to do this episode because we wanted to bring awareness and kind of, inform other people about these things, because it's just amazing what's out there and how little or how lonely you can feel in a certain situation. And I just wanted to ask, is there anything that you would have wanted to know, or anything you would like people to know, or anything you want to add?
You know what, I think it's like both of you have said, it's like you've got a voice and you know your body. So if something's not normal for you, then it's not normal, like, period, end of. Like, you may be able to handle what's normal for you isn't going to be normal for me, so we can't compare ourselves to anybody else. Like, as soon as it crosses that line for you, then get it checked out and keep going back again and again, or get a second, third, fourth opinion. And I think it's just arming yourself with information. Like Erica was saying, you Google, it might be your best friend or your worst enemy, but at least you've got the information out there anyway, because nobody else is going to do all that legwork for you, unfortunately. And I think to cut down a diagnosis time is just to keep going back and again and again. But there's so much support out there, and there's such a community out there, and I'm like, even just your platform, just to have the opportunity to raise awareness and to have such an open conversation, because not everybody is as open or receptive to different conditions and how it impacts everybody's life. So it's so refreshing as well to be able to talk about endometriosis and stoma bag, but have a laugh with it as well. Like, it's a serious subject, but like, I don't think I'm a serious person, so it's nice to be able to have, like, do it with smiles as well.
And also, it's your, like, it's what you're living. It's that it's not stopping you from being the person that you are or doing what you want to be. So why are we all, or society, going to frown on you or be like, oh my god,
like, feel awkward for you, when in reality, it's what you're living. You need to embrace it. This is me. And I learned that this is why when I reached out to you, I loved the picture of of your bag, the balloon. It literally, I sent it to Jess and I was like, oh my god, I think we found her. Because we always look for someone that we think will be the best fit. And this is an episode that our followers have asked for a lot, more awareness, because when we brought in the girl with MRKH, everyone was fascinated, and as women, I feel like we should be educated on it, because like I asked you, what brings on endometriosis? You don't know. It can happen to me down the line. It can happen to Jess down the line. It can happen to absolutely anyone. So the more educated we are on certain subjects that can happen to us, the better. We won't feel alienated, and we will feel like, okay, well, I kind of know who to reach out to. I have the resources to kind of like get more information. If I am going through some of the symptoms you went through, I will go out there and kind of like, can you do this? I had someone go through this, so I want to get the same kind of referrals and stuff.
I think that's the thing as well. Like, social media has been so powerful in the sense that you put up like one story or one post, and people say, oh, I've experienced X, Y, and Z. It's similar to yours. What would you recommend? And we're not medical professionals, but I can give you my own personal opinion what I've been through. And if that helps you, and like you said, someone may listen to this and take away, oh, my sister's got this, or my mum, whoever's been through this, there's someone that I listen to on a podcast, maybe I'll reach out to them and see if they'll respond to me. And you build it that way. And I think you just build up your connections, or you expand your knowledge as to who could give you some sort of an answer, which is quite powerful. And I think even today, like International Women's Day, is just amazing to be able to do a podcast with you girls as well, and to talk about something that I feel passionate about, and to help me help you.
I think what you just said there is, and we've seen it a lot throughout our episodes, that we'll see people have started following the guests that we've had because they feel like that person can help them in their life. And it's just, like you said, grow a community and connect people, because that's what it's about. It's not so much of like, oh, you know, networking with this job or that. It's more so your own personal life, because you don't really know what someone out there is going through the same, or thinking, oh my God, what's wrong with me? Or so yeah, I think that's amazing. And you literally were the perfect match, because I'm sure someone else might have been a bit like, my bag, but it's normal. Like, embrace it. If anything, we wish we had one so we could walk around with the rainbow coming out of us and a balloon floating us around.
I will happily send you one, fill it up for you, just stick it to stomach. I'll give you the special spray to take it off as well.
Just like Skittles, taste the rainbow.
Oh yeah, it's taken such a journey to even get to the point where you can like laugh at it, but it is what it is. Like, it's not going away anytime soon either. So yeah, like I said, it's amazing to just have an open space to speak so freely about it as well. So I will definitely tune into more episodes that you guys do, because yeah, you've got good energy.
Thank you.
So Tanya, we usually like to end our episodes with a golden tip. Now, you've said a lot of things that I feel like fall into place, but is there anything, you know, a tip or a positive message that you want to add to women, you know, maybe International Women's Day, just an empowering message, or something that someone that could be going through the same that you may want to add?
What would I say? I think, big question. You know what, I like to say to like my friends and empower people around me that like we are our own power. We have our own voice, we have our bodies, and we advocate for ourselves. It's so easy to take advice from everybody else and to help everybody else, but let's help ourselves as well. And we've got a voice, so let's use it. Let's use it to shout about what we're passionate about, you know, to help ourselves, to get our diagnosis, to get our jobs, to do whatever we want to do. We can change so much and do it together. Yeah, let's do it.
Girl, you said it. Your voice is the most powerful thing.
100%.
It's been very insightful talking to you. I feel like I've learned a lot. Do you know what? Like, I feel like I've learned more with the podcast than what I actually learned at school.
Yeah.
I'm like, where was all this information when I was growing up?
Thank you so much. It's been so great, and keep doing you and keep embracing it. You are powerful, and it's beautiful to see.
You are absolutely. Honestly, you have 2 more supporters over here. We will rock with you for life.
Another one over here.
Mama's Code out. Mwah.
Mama's Code.